Hi, my name is Tristan. It's January 23rd, 2019, and today I'm going to be suctioning a trach and doing a dressing change. So the first thing I want to do is make sure that my patient's being hyperoxygenated because we're going to remove the oxygen to suction. So for suctioning purposes, you want your suction to be turned on between 80 and 120 millimeters of mercury. Mine's turned on. I've done hand hygiene. My patient and I have established a communication, a way for her to be able to give me a thumbs up if I need to stop or anything like that. So I've also got this pad on the patient's chest to make sure that we don't get stuff everywhere, and I'm gonna set them up into a high Fowler's position just to help with the suctioning and how they're breathing and stuff like that. So let's get started. So I have my suction catheter tray right here. This is sterile. I'll put this over here for now. I'm gonna put on some sterile gloves. And there are none in here, so let me get a pair from here. So pretend these were in there. Okay, so I've got my sterile gloves on. So in my kit, I have this sterile water, which I would pour in here. And then I have my catheter that I'm gonna suction with. So going to attach this to my suction and then remove the oxygen from my patient. And then whenever I'm going down into the trach, I want to make sure that my thumb is off of this. So on my patient, okay, we're going to go down. And then as you come up, twist and turn and intermittent suction. And then I can suction out with the sterile water and then go again. Twist and turn and pull out. And then suction, and then if I need to go again, I can. And also before I started doing all of this, I checked his lung sounds and secretions and mucus, and we decided that suctioning was needed. So then when I'm done and they're suctioned, you can go ahead and put this back on them, and then disconnect this and dispose of this in the trash can. Next thing we move on to is this cure kit. So get out my sterile gloves. So in this packet I have some hydrogen peroxide and some sterile water. So what I do is, there's two pockets in here. In one pocket I do half peroxide, half sterile water, and then the other one I do just sterile water. So then we're going to, once again, take the oxygen off. And then take off this dressing, keeping this hand sterile. I would only touch the dressing with this hand. So then I would grab and take the trach out. And then you can put it in here. And I can use like a pipe cleaner and clean it out. Keep it nice and cleaned out, and then put it in there. And then I can use like some gauze to wipe around and wipe some of the gunk off of the, like this palette if it gets stuck on there. And then we can put this trach back in there. Make sure it snaps. And then we're gonna put our gauze under the plate. And you can take off or disconnect the side of the trach tie just to kind of give you some room to pull this, put the gauze under the plate. And just make sure that you're watching and looking at the skin and assessing that there's no like erosion or anything, because all the secretions that can build up can really cause irritation on the skin. And then this trach tie, if it is soiled, you can grab another one and just change it out. Just do one side at a time so that the trach stays secure and in place. And then the old one, wrap the new one around. The old side off, the new side on. And then adjust it as you need to, and then just make sure that you can get 2 fingers in here so that you know it's not too tight. And then put the oxygen back on, and then make sure you document everything you did. Make sure you document the secretions, how much you suctioned out, the color of the mucus or the secretions, and how the patient tolerated it.